My name is Brenda Vasquez, and today I will be discussing the topic of healthcare in Mexico in comparison to the United States. This is something that is not widely discussed, but it is something that I believe to be important. I think that this topic is important because Mexico is our neighbor to the southern border, and there are grave differences between the healthcare access and healthcare outcomes of people in comparison to the US. So this just goes to show the difference between a first world country and a third world country, and the differences that are separated by just a single border. So I first decided to take a look at the type of healthcare system present in both of the countries, and this is where the countries seem to have a similarity. So both the United States and Mexico don't have a unified system of care. The United States actually, like we know, doesn't have a universal healthcare system, and it is publicly and privately funded. So in Mexico, we see that it has like more of a private system, but it also offers universal health insurance programs that is different from a system, and it's just programs that are only available to a certain population. So not everyone has access to this universal health insurance. So with that being said, Mexico is actually considered to be a mixture of private, public, and employer-funded schemes. Here in the U.S., there is also employer-funded insurance. There is also insurance that you can get through your job and things like that. But more so, there is private and public insurance here in the U.S., like Medicare and so on. Moving on, population health is something that is important to discuss because that really goes to show like everything that is happening with access to healthcare and so on. So the thing I decided to look at was infant mortality rate per 1,000 live births. And this is where you can start to see the gap between the two countries. So Mexico, as you can see, has an 11.6 infant mortality rate per 1,000 live births, while the U.S. has only 5.8. Here, it is a direct comparison, so you can see that Mexico actually has exactly double the infant mortality rate than the United States. So that is the first place where we can see that there is truly a big difference between living in a first world and a third world country. So healthcare spending is also very different between both of the countries. And taking a look at this graph that lists many countries on the bottom axis, you can see that the U.S. here in red, here, is at the top of the list, while Mexico is towards the bottom in regards to spending. It is next to Colombia and South Africa. Mexico only spends $1,034,000 per capita on healthcare, all while the U.S. spends $10,209 per capita in healthcare. And this really shows the difference just because usually the more spending, the better healthcare outcomes there is, which goes to show that there may be lesser healthcare outcomes that are positive in Mexico due to the lack of spending on healthcare. So in regard to the healthcare system, I decided to take a look at adequate prenatal care in first trimester of pregnancy due to the fact that I had looked at infant mortality rate before. I thought it was adequate to look at prenatal care. So to my surprise, these percentages are actually very similar in both countries. They are both in the 70th percentile. So Mexico is at 71.5% of pregnant women are receiving adequate prenatal care in the first trimester of pregnancy, all while the U.S. has a 77.1%. This percentage in the U.S. is still higher than the percentage in Mexico, but it is not such a large gap as we have seen in other instances. But even though it isn't seen as such a large gap, we have to take into consideration that the population of Mexico is smaller than the one in the U.S. So in that way, it can be put into into perspective. And also you can get from this that maybe this is one of the reasons why the infant mortality rate is actually larger in Mexico than it is in the US due to inadequate prenatal care and more women in Mexico than in the United States. So I also took a look at public and health prevention. So for this, I looked at percent of children 19 to 35 months who are vaccinated. And when I say vaccinated, I am talking about the full round of vaccinations, not just one or two or just some. It would have to be the complete round of vaccinations that is needed during childhood and during these ages as well. So taking a look at this, you can see that we can see a large gap between both of the countries again. In Mexico, there are 34.3% are vaccinated, and in the US, it's 72.2%. In this day and time, there are less children being vaccinated in the United States than there were before due to the anti-vax protesters and propaganda and things like that. But even so, the United States still has a larger percentage of children being vaccinated than in Mexico. As you can see on this map, you can see that we're here in Ohio, and Ohio has a much lower percentage of children being vaccinated than a lot of other states and a lot of the surrounding states as well. So that just shows that Ohio is actually in the 64 to 68% of children being vaccinated and receiving that full round of vaccinations. So the physical environment is actually something that is very important for health. It is a factor that directly correlates to health outcomes of its people. So the better the physical environment, usually the better the health. And in regards to the physical environment, I decided to take a look at people using safely managed drinking water services. And for the percent of population in Mexico that is using safely managed drinking water, it is 42.61%, which is exponentially lower than the United States, which shows a 99.02% of people using safely managed drinking water. This is kind of shown in this map where the US is a darker blue than Mexico, and which means that there is more safely managed drinking water being used in the US as a whole in comparison to Mexico. This is important to take into consideration just because this just shows the lack of access to basic resources that there are in Mexico. Water is considered a basic need and a basic resource, and 41.61% of the people in Mexico are the only ones that are actually having access to this basic need. And in comparison to the United States. So this is actually one of the statistics where the difference between a first and third world country is actually very evident. Also, this is one of the reasons why, if you have ever traveled to Mexico or plan to do so, a lot of people always say don't drink the water because the water is well known to be not very safe to drink. So in regards to access to care, it is important to look at the population of the insured individuals because it is seen that if people have health insurance, they are more likely to seek care due to the very large cost of healthcare. They need health insurance in order to be able to receive the services. So I decided to take a look at the rate of uninsured adults in both Mexico and the US. So in Mexico, 73% of adults are uninsured in comparison to 15.5% in the United States, which again is a very big difference. But the US hasn't always been this low. As you can see on this graph, around 2013, we were more towards the 20% area for being uninsured, but as time went on, we progressively started to get lower in the percent of uninsured adults, and this would all be thanks to new policies being put into play and like the federal programs like the ACA and things like that that have allowed for more people to have access to healthcare. So in regards to the social and economic environment, I looked at unemployment rates, and this is where Mexico and the United States are actually very similar. Mexico is only 0.2% less unemployment than the United States. Mexico is at a 3.6 and the United States is at a 3.8. So you can see in this graph that they are very similar in this point in time, even though the US had a much larger unemployment rate a few years back. So in conclusion, you can see that there is a big difference from being a first and third world country. Neither Mexico, the only similarities that were seen in both of the countries were that they both don't have a unified system of care. Also, their unemployment rates were similar, even though Mexico is doing a little bit better than the United States. And as well, prenatal care is very similar as well, as they are both in the 70% area. But other than that, it is seen that the United States is doing much better than Mexico in many of the other areas like immunization of children and access to clean water. So this just goes to show that there is a very big difference between a first and third world country. And it is just important to keep in mind. Thank you so much.